Hello, my name is Dr. Jeff Aberle, and in this video I'm going to try to explain to you how the spine and spinal malpositions and distortions can cause basically any type of ache or pain that you're experiencing, whether it's headaches or knee problems or back pain or neck pain or tight muscles anywhere in the body. All that's explainable. And so in this short video I'm going to try to do my best to explain that. So what you're looking at now is a video of normal spinal motion. And what I want you to kind of get from this is that every bone participates in the motion. Every bone is contributing, every bone is moving, there's no stuck areas, and things are good. When you look from the front or from the side here, you see a curve in the neck, you see a curve in the thoracics, and you see a curve in the lumbars. From the back, everything is perfectly lined up. Now, most people think that their spines look exactly like this. And when they have an ache or a pain, and they might even think that something's out in their back. They think that one or two little things have gone wrong, and they think that you just get, a treatment or two, and everything should be back to normal, and they should be pain-free. This is what most people, I think, believe. But there's much more to that. So let's just real quickly show what abnormal motion is like. And yep, this is a whole nother video. But this animation starts out this way. So what we're doing is we're taking a happy, healthy spine and an unhappy spine, a very twisted up, distorted frame. And believe me, a lot of people have this. You might be one of them. You might not look exactly like this. You might not even look even close to this. This curve on you might be up here. You might actually look fairly straight from the back, but over here you've got multiple curves all embedded within the primary curves. Remember how I said there was one neck curve, one thoracic curve? Well, here you can see there's three curves in the thoracic. There's one there, there's a reverse one there, and then there's that one. So lots of people have multiple curves as you run your finger down their back here or measure on x-ray. So if you've got a problem, you've got an ache or a pain, that's probably why you're watching this video actually, you probably have a whole bunch of these spinal distortions as well, and there's no way you're fixing this in one or two treatments. It's impossible. You might be able to get rid of pain in one or two visits. That happens once in a while, but usually this is more of a process to actually correct this stuff and reverse this back to this position. The good news, it actually is possible to do that. That is the good news. Okay, let's go to the animation. So here what we're going to do is we're going to show that crooked, distorted spine and how it moves relative to the normal spine. So here we go through the same ranges of motion. Not the same distances, but the same types of motions, but the ranges are obviously going to be different. The actual value amounts and degrees. But what I want you to notice here is that chunks of bone are moving relative to the other pieces. And you'll also notice too that I cut the spine in half here. I'll show you why I did that here. I didn't bother remaking this animation with a full spine because I want to show you what's internal. But you see how that all moves as a chunk? Now over here it actually moves to the right and you can actually see individual motion there, but to the left that thing moved as a chunk, a block. Now it's interesting, when someone comes in with a spine like this and I actually start treating them, it feels like I'm working on a block of wood. So a lot of people, especially young people that haven't had a lot of time to get a lot of these distortions and twists and all this stuff, they have more flexible spines. So when I put them up against the wall and they give themselves a hug and I push them lightly up against the wall, and you can see other videos that actually show the actual treatment being done. So with someone like this, it feels like I'm pushing a block of wood up against my hand. And for maybe a teenager or something like that, it's not that way. Or somebody that's has good spinal health. Their spine actually feels flexible, and that's really interesting. And people that come in that have these really stuck spines, and they're not even aware of it because they lost the motion gradually. So the ranges of motion aren't that good. They're very stuck in certain areas. They often hurt, and that's what we're trying to cover here. So what I want you to get from this, I want to just go over some anatomy. Now, by the way, why I split this in half is so you could see the internals, okay? And so here you can see that same healthy spine with the body cut in half. So what we're looking at here is obviously the brain. This is the cerebellum, and behind this, and more towards the center, is the brain stem. So we got the brain stem, and that continues into the spinal cord, and then spinal cord ends here and then continues on to spinal nerves. It branches out into the spinal nerves that then exit down lower. The blue structure is the meninges, and the meninges are the most overlooked structure in healthcare. I just can't believe nobody ever talks about the meninges. And so we're going to talk about them. You're going to have a little bit of an idea what they are. If you haven't heard of the meninges, I'm sure you've heard of meningitis, and that's inflammation of the meninges. And the meninges are very strong, and they're shown in blue here. There was an anatomy professor up in Canada, and he told us that they actually took the meninges out of a cadaver, and they pulled a car with it. So they attached one end to the back bumper of a car, and the other end to the front bumper of a car, and they were able to pull it. I doubt they accelerated real quick, but it just shows the strength of this very small tube-like structure. Not the checkerboard thing, but I'm talking about the circular thing that goes, we're only seeing a half tube going down here. So that blue structure that you see is very, very strong. But the problem is it can get adhesions in it. And the adhesions lock things up. So what am I saying there? Well, first of all, how a person goes from healthy to sick is by one simple concept. And this concept is that our bodies have bones that can go out of place in directions our bodies can't self-correct because we literally have no muscle to pull the bone back into place. And this is the fundamental problem that Dr. Jesse Jutkowitz figured out. He figured out how to take a distorted spine, the billions of combinations of distortions that a person could have. He figured out how to take that and reverse the process. That is an extraordinary accomplishment that no one's been able to figure out. How to actually take anybody that walks into the office, and provided there's not too much damage to their spine and bone, the bony structure in general, or they don't have some, defect, a genetic defect or birth defect, you can take somebody from here and restore them. It is unbelievable that it is actually possible, and it's not regular chiropractic. It's kind of almost the opposite of regular chiropractic. And again, that's better served in a different video to cover that. So if we, when that comes out, we'll put a link here, and we'll, on this page, and you can click over and watch that right now if you want. But needless to say is that the spinal cord should be in here. It shouldn't be touching the meningeal tube at all. There should be space between the two all the way along in the front, the sides, everywhere. But when you get these distortions, you'll notice that the spinal cord actually now is glued to the front and glued to the back and glued to the back there and the front there and the back there. And this thing is tethered in a whole bunch of different areas. And this tethered cord syndrome is very prominent. Lots of people have tethered cord syndrome problems, and they're not even aware of it. Most neurologists don't even think that this exists nearly as much as it does, which is so unfortunate, because if you have numbness or tingling, you have some form of a tethered cord syndrome. And it's changeable, it's fixable if you know exactly what to do. But anyway, we don't want our spinal cord attached to this. This is not normal. And it adds extra stretch to the cord itself, which can then impair the nerve function from the brain to your organs and cause disease. So you fix this actually by doing meningeal releases and by correcting the bones out of place that the body cannot self-correct because there's no muscle pulling in the direction needed. And the bodies then start reversing the process, and they actually go back more towards that. Now I'm showing this here from one start point to the next, and then I'm showing you the transitions. I just let the 3D program fill in the transitions. It doesn't happen like this per se. You actually unwind in way different ways, and so you're at times your head might be over to the left, your whole body might be tilting to the left a little bit, at other times tilting to the right. And I'm not showing the whole winding up procedure here. I'm showing one position and then the next, and then I'm just showing you letting the computer fill in the blanks. But there would be all kinds of different positions your body would go through en route to this messed up spine, which would appear more messed up as you age. But it has nothing to do with aging. It has everything to do with how many more bones you've gotten knocked out in daily life. That's what's going on here. Okay, so back to the meningeal adhesions. Like I say, the meninges are the most ignored structure in healthcare, in my opinion. And the reason why is because nobody really thinks that they're ever even a problem. But they're a huge problem, and they actually support you in a good way when you're not getting treatment. See, if we didn't have the meningeal tube in here, and it's adhesions that form and get everything stuck, we probably wouldn't even be around as a species, because we would have tugged our spinal cord so much that we would end up dying. But the meningeal tube actually prevents a lot of that from happening, and due to the adhesions that lock up, say for example, this area can't bend forward anymore and stretch the cord anymore or pinch it off, because it's now kind of frozen together. But when you're trying to fix somebody, these meningeal adhesions totally get in the way, and you got to start pulling them apart. And meningeal adhesions are best explained this way. So let's just look at some aluminum foil. This is the best analogy that a person can really come up with for this. So this would be healthy meningeal tissue. There's very little wrinkles in it, and it's smooth, and it's, again, remember I said this is very, very strong, unlike aluminum foil that isn't that strong, even though it's metal. But there's no adhesions here. Yeah, maybe a few little ones here, but let's just ignore those. Let's just pretend I had a nice clean piece of tinfoil out there, okay? But if you go over to here, you'll see that there's a lot of wrinkles. And all these wrinkles are just from crinkling up the aluminum foil and then pulling it back apart again. Everyone has done this at a party. You know exactly what I'm talking about. But this is some pretty, moderate, let's just say moderate meningeal adhesions in this tissue. And then this is extreme. So if somebody came in with meningeal adhesions that were like this, their entire spine would feel like a board. Their range of motion would be terrible in any direction. They would probably be bent forward, like an elderly person. But, I've had a lot of people, I cringe when people come into me and their professions have been farming, landscaping, or if they did gymnastics for years as a kid. All those types of things have a profound impact on your spine in a very, very negative way. And it takes longer to usually fix those people in general compared to the rest of the people, the rest of the public that isn't doing these crazy jobs. They're not doing all the heavy lifting all the time. They're not having the falls like you would in gymnastics that knock lots of bones out of place. But anyway, back to the meninges. The meninges actually are helpful, like I say, when you're not treating people. They actually help support you even though you're dysfunctional. But when you're trying to fix somebody and correct those bones out of place that the body can't self-correct, you got to pull these apart. And this is through meningeal adhesion or meningeal releases. And Dr. Jutkowitz that figured out how to do this, he figured out how to pull these meningeal adhesions apart. And this is part of his entire method for correcting the human body. So for correcting people, like I say, and I'm going to leave this better for a different video. You pull apart the meningeal adhesions and you start pushing bones back into the directions that they could not self-correct on their own. And with that comes massive pain relief. And I am serious. I mean, you can solve problems that nobody else can fix using his method. Now, if you've got like 6 different problems, what you generally find is several of them go away quickly and some of the other ones hang around. They take a little longer to fix. But it is possible to take somebody that has that really messed up spine like this and actually reverse this process. And the cool thing is let's say you're like this. All you might have to do is take the person to this and they feel tremendously better. You don't even have to undo it all. So you could take somebody from here and sometimes it's just, a few treatments, 10, 20, something like that. You can make massive changes in these people's lives, even your life, without even fixing all this and getting you back to perfect. Now, obviously, everybody would want the perfect spine. If you could feel the perfect spine in your body right now, you'd be so sad when you had to go back to where you were. If you could just feel that for, say, 10 seconds. I'm hypothetical, okay? But what happens is his method slowly changes this, and you can actually restore your spine to a happy, healthy spine. Now, again, it does depend on how much damage you have. Like some people they've got so much arthritis in the low back or in the neck or something that you're not going to be able to make them perfect, but you're going to be able to provide tremendous relief for them. And that's what's important. People want pain relief. Not everybody wants to die with a perfect spine, but people want to have a healthy, happy life, especially in their older years. They don't want to be in a nursing home with people having to do, having to give them baths and deal with bodily functions and all that sort of stuff. Nobody wants that for their life. But so many people choose to just ignore their bodies. And once you learn about this spinal correction stuff and see some of the other videos and see how posture is so dramatically influenced, by these bones out of place that the body can't self-correct, and how this leads you directly in to the nursing homes, the assisted care, the assisted living facilities, and needing people to take care of you in your older years. I think our younger generation is now seeing this. People, they say that I don't want to be like, grandma and grandpa. I don't want to have that happen to my body. And so they're looking for alternatives. They're looking for ways to actually correct the problem instead of just masking their pains with drugs and painkillers and morphine and stuff like this. They're tired of it. So anyway, I hope this gave you a brief idea of how spinal mechanics plays a role here. Again, what I'm going to try to do is I'm trying to make all kinds of different videos that cover different problems. So I can explain this stuff on the spine, and it might make sense to you, but you might not understand how the spinal distortion like this could cause, say, for example, a knee problem. Why it could cause plantar fasciitis, why something like this could cause headaches. That might not make a whole lot of sense quite yet. But this is more of a Spine 101 video, if you want to think of it that way. It's showing the basic underlying things that go wrong and go funky, and in other videos we'll explain more. So, subscribe to the channel. As those videos come out, it'll all be on this channel, and I'll always be linking to any other videos that I find extraordinarily exciting and useful for you, that'll help you solve your problems and gain more health for your body and live a happier, healthier life. So again, make sure to subscribe. My name is Dr. Jeff Aberle, and I appreciate you taking the time to listen and watch my video. Thanks.